Maintenance therapy is important in these patients. There's a little bit of controversy. Some of our myeloma expert colleagues don't believe in maintenance therapy, but we do believe, after a couple of massive studies, the CALGB 10104 study, the French IFM study, 2005, that maintenance clearly improves progression-free survival, probably improves overall survival, and that includes patients with high-risk disease, which is a particularly unmet need in the area of myeloma, because patients with high-risk disease, about 20% of our patients, relapse early and die early, and we need to approach them perhaps more aggressively than we have been, or certainly differently than we have done. But the initial therapy of myeloma, it clearly is triplets, transplant, maintenance. That's going to change over the next year or two with some very, very exciting new drugs.